Giving me an up-close and personal view. Hello and welcome to the Joanne Powell Show. I'm Joanne. We're coming to you from the World Center of Broadcast Media, Hollywood. We're continuing to following some breaking news as we come to you on our live stream. In London, there's been a terrorist attack where 4 people have been killed, including a police officer and the assailant, and there's 20 people that have been injured. Basically, what happened is the alleged attacker drove his car across the Westminster Bridge and plowed into some pedestrians crossing, crashed his vehicle, went into Parliament where he stabbed an armed police officer. He was shot and killed by police. They're continuing to look into this incident, but they say so far it is just a single attacker involved. Once again, the attacker was killed along with a police officer and 2 others. Total 4 people killed and 20 people injured. In other news, we are the 7th year anniversary we're celebrating for the Affordable Care Act when it was implemented. It is the day before the Republican plan is going to be voted on in the House. And now President Trump is out there campaigning to get Republicans on board. Right now, there is not full support for this measure. But we are going to take a look at this bill and talk a little bit about it. Joining me now is Damon Cianci. You are a professor at Cal State Northridge in Health Sciences Department. We were talking a little bit before the break about some of the aspects of this bill. One of the things that we were talking about off camera is that the way that it was, you were determined on basically what you paid based on your availability, your ability to pay, and that's going to change.
Right. The current process, it's a sliding scale of affordability. And under the plan that is supported by Trump, it's basically going to be age related. So you'll get tax credits or tax subsidies. The issue, though, is what if they're wrong? What if those tax subsidies doesn't really pay the full cost of care? Because we know that individuals that are over 50 years old use 3 to 4 times more services than individuals that are under 50 years old. And we certainly don't want the Americans paying more for health coverage.
Now, I know there's a concern by AARP to make sure that before they made some adjustments to it, they were looking at paying a lot more, and a lot of people are on fixed incomes and couldn't afford some of the premiums that they were seeing, and that was a concern that people would have to decide whether to buy food or their medication or going to the doctor, which is something that we don't want to see.
Absolutely not. Just think about this, too, that in 2010, when the Health Care Reform Act passed, the uninsured rate was 23%. That's 1 in 4 Americans didn't have access to health care or had very, very poor access in terms of their coverage. The rate now is about 9%. And that's the right thing to do, is providing individuals access to coverage. And I think we need to continue that and make changes, surgical changes to this bill, but not pull out the good old chainsaw.
And then one thing that I find interesting about this whole issue is that pretty much everyone in the medical field is not in favor or support of this proposal, which should be an indication that there are some issues with it. It looks like it's more a political issue than it is a real healthcare solution that will impact positively the lives of Americans.
Yes, I agree. Again, I strongly believe that healthcare should be an entitlement. It's a right. People live and breathe healthier lives when they have access to coverage. You would want individuals to get their mammograms, get their screenings, access primary care services, address their health conditions early on versus waiting till it's too late. And, preventing cancer, things like that. So it's actually very important that people have access to coverage. And I think this bill was basically just a cut and run bill. The thought was it's just too expensive and we can't afford it. The problem, though, is that the people who need it the most will be left out of the system.
And there's one issue that you were talking about getting screenings, things like that. I mean, it makes me think about an aspect of this bill that because they want to take away funding for Planned Parenthood. And the issue there, to appease the far right that are against abortions, that is a service they provide. No federal dollars go anymore toward any funding of abortion, but Planned Parenthood performs them, but it's only a small percentage of what they services that they provide. So now you're going to have millions of women, children, and their families that are not going to have a place to go to get that health care. And there really are no other medical facilities that can handle that number of people that are going to automatically be without a place to go.
That's right. There has been multiple studies done that people who don't have access to health care, when I say health care, I also refer to mental health services too. People who don't address mental health issues, suicide rates go up, domestic violence rates goes up, child abuse goes up. And so that's the issue, is if you, under this current proposed plan, the less people covered, those incidence rates are going to go up, and that's the wrong prescription for America.
I know from the political aspect, they are talking about, this is the Republicans, this is our chance to replace and repeal, and, the Republican Party, is their promise was to do this. But you want to make sure that you replace it with something that's viable, that's going to be beneficial to your constituents, because they're going to remember if they have a plan where they're not able to get any health care, or they had health care, now they're not going to be able to have it, or their premiums are going to go so high that they're not going to be able to even afford to go to the doctor or get medical care.
Absolutely. If you look at the states in America that have really high levels of health disparities, obesity, hypertension, cardiovascular disease, out of those 10 states, about 8 of them are in Republican-dominated areas.
Okay.
It's Kentucky, it's Tennessee, it's Mississippi, it's Louisiana. And you're right, these constituents won't forget.
No.
They may have voted for President Trump, but I think in the end here, they're going to wish that they actually voted differently, because they will lose their health care because they won't be able to afford it anymore. And
that's another thing that a lot of the Republican lawmakers that are not on board realize, that they have to listen to their constituents more than what the party wants them to do. Who's strong-arming you more, like who's going to vote you back into office, the Republican Party or your constituents? So a lot of them are knowing that it's their constituents that are the voters that will get them back in office.
Yeah, I agree with you. I don't think this bill was well vetted outside of the legislature.
Right.
I don't know what their total process was, but I feel that there is some heavy shortcomings in this bill. And I think not allowing to expand Medicaid, and like you mentioned, the CBO, there's going to be tens of millions of people that will be left out of the system. That is not the direction an industrialized nation should go. Other countries have universal health care, provide good access and good coverage to their public, and it's unfortunate that America still has not gotten to that level yet. But I did strongly feel that the Obamacare Act was certainly a good start, and I really wish that the parties in Capitol Hill would really take the scalpel and make some concerted adjustments to it, versus making a cut-and-run bill like this is being proposed for tomorrow at the legislature.
Okay, we'll definitely be following this, but thank you so much for coming on the show. We're going to have you back on, because this is an issue that is definitely not going away.
It's my pleasure to be here. Thank you for inviting me.
Okay, yes. When we come back, have you ever had an issue with your cell phone, your laptop, or your tablet when it's crashed on you, you think you've lost all your data? What do you do? Coming up next, we're going to talk to someone who's got some tips to help you in your crisis. So stay tuned. You're watching the Joanne Powell Show.
If you are an adult that began college and has not finished your college degree, let me put it to you straight. If your lifestyle and your standard of living is not becoming to you, then you should be coming to us, Oakwood University Elite Program. We are the fast, flexible adult degree completion program for the busy adult, like you.
Register today. Go to oakwoodleap.com or call 256-726-7098. It's time to leap.
For years, people have trusted McKay's Family Mortuary. We're part of your community and we'll take care of the details. We offer a variety of memorial services, including sea scattering and cremation. According to the Federal Trade Commission, the average funeral cost is over $9,000. We have complete funeral chapel service starting at only $31.25, casket included. Direct cremation starting at only $9.95. Visit one of our 5 locations and meet our caring and diverse staff. McKay Family Mortuary. Let us be the shoulder to lean on.
Thanks to Oakwood University and the LEAP program, I have now a college degree. So to the Spanish-speaking members of this community who feel that the LEAP program is something you should consider, I would say, ánimo a la universidad. Considere el programa LEAP de Oakwood University.
Go to oakwoodleap.com or call 256-726-7098.
Seize the Day Scuba for your best scuba experience above and below the sea. You'll find friendly staff, experienced PADI certified instructors, and state-of-the-art scuba equipment and gear. Join our dive club and we'll help you plan memorable scuba excursions. Immerse yourself. Seize the Day Scuba, serving Southern California. Call 949-220-0500 to create your scuba experience.
When I first started into the program, yes, I had doubts. I was really impressed with Oakwood University, with the faculty and the staff and the student body. It was a really good experience, and I would definitely recommend it to anyone who was thinking about going back and finishing their degree.
Register today. Go to oakwoodleap.com or call 256-726-7098.